Thank you so much, Hannah. Erev Tov, Kulam. Thank you so much, Hannah. Your very kind words. I really appreciate it. And there's a lot of thanks to give, but obviously particularly to Ronnie and to Avi. It's just been a pleasure. Easy, just a pleasure. Really, really an easy thing to pull this off. I have to say that I'm very pleased to be here this evening, and I'm extremely sad that I'm not there with you, which, you know, with all the unpredictability, you can understand. It's just, we went back and forth a number of times. I'm sorry I'm not with you in person, but we will make do, and I will be there hopefully soon. Also, I want to thank Ami and Danny for your discussions. I know we'll be talking later, but thank you ahead of time for taking the time to think and write about the paper and so on. The paper, The Untelling and the Unpassed, Working with Frozen States. The case in the paper is a case I have talked about before, but there are different angles on it. So hopefully there will be shed some new light if those of you who have seen me present before. Okay, so it seems to me that the fulcrum of psychoanalytic healing has shifted from a focus on interpretation and making the unconscious conscious to an appreciation of other realms of experiences and states that emerge in the treatment. We are these days interested in the non-represented and non-symbolized, and the emergence in treatment of various registers of being and non-being. There's a shift, if you like, from epistemology to oncology, something that leans on Ofer Eshel and on Thomas Ogden, who've noticed that shift. From attempts to know the patient intellectually and cognitively to being with the patient and the knowing that exists in the realm of unspoken witness and shared states of consciousness. We now place the analyst well within the field of the treatment and the patient's inner world, and yet to be thought or symbolized trauma come to be known via emergences in the field and often within the analyst's body and mind. This shift, I think, reflects the increase in clinical engagement with patients and states characterized by damaged relatedness and fragmented, constricted, and bizarre experiences of intersubjectivity, where symbolization and reflective function are greatly limited. It is in the context of this new and more ample psychoanalytic space that I want to consider with you how enactments can be profitably understood as narrations of what is yet to have form in the mind and memory of the patient. Such thinking takes us into the realms of timelessness and spacelessness that have intrigued psychoanalysis since its inception. Dominic Scarfone in Canada, Toronto, wonderful analyst, outlines the concept of the unpassed to describe transferences and analytic situations that capture elements of the analysand's mind that are not yet represented memories and therefore cannot be said to exist in a past. Scarfone draws our attention to Freud's observation that what is repressed is untouched by time. And that's an interesting focus. I was always taught simply that, in the unconscious, there's no time in the unconscious. He reads Freud very carefully and says, it's not quite that. It is that what is repressed is untouched by time. And I found that very meaningful distinction. These mental contents exist in what he terms an unpassed. I find that this formulation resonates with our contemporary understanding of trauma, dissociation, and enactment, where what is yet to have form in the mind finds expression in the ever-present, what Scarfone calls the actual, of the enacted dimension of the treatment. Thus, I suggest that it is useful to regard enactment as an untelling of an unpassed. I view enactments as mutual co-narration, of what has yet to be symbolized or formulated. Rather than seeing enactments as impasses and blocks to the unfolding of the treatment, we can regard enactments as a call from another register, another realm from within the patient. We know that massive trauma and the ongoing developmental traumas of non-recognition and neglect are registered in somatic and dissociated zones outside of the verbal and symbolic. In some measure, these things have yet to happen or to be experienced. They can be said to exist in the unpast. And we find the unpast as presented in action rather than represented in the verbal or symbolic dimension. It comes in action and in presentation. It is the analytic pair or the analytic group that comes to tell the story of actual trauma or internal object relations that cannot be told in words because it is yet to exist. Hence, the analyst and patient embark on a journey where the patient's unformulated, unsymbolized trauma and breakdown will come to be realized in the inactive field of treatment or within the inactive field of the group. When the analyst can be unobtrusive to this emergent field and can companion the patient in the flow of this enactment, in which both analyst and patient participate consciously and completely unconsciously, like a lived emergent form of free association in lived. We find a psychoanalytic narration of past trauma and neglect that analyst and patient enact and live together. The unpast is thus incarnated in the treatment. This is the untelling, where the unpast can finally become lived experience and a part of the patient's self and narrative. I've greatly reduced the explanation of Scarfone's theory for purposes of time, but there's a lot more that could be said. Now, you'll notice that this view of enactment is different to the view that has been central in much of relational theory. And in way too short, that view highlighted enactments as in the emergence of dissociated self-states that do not allow for thought and process and progress in treatment, as impasses and blocks in the unfolding relatedness of the treatment. Such a view asks the analyst to become aware of enactments and to resolve them so that the treatment can get back on track. Now, my approach kind of turns this around. Viewing enactments as an untelling, as narrations of an unpast, I'm less interested to move us out of the realm of enactment, but rather to allow myself and the patient to flow more fully into this world of unsymbolized communication and enacted co-narration, to unobtrusively companion the patient in the very register in which the past trauma or neglect is inscribed. We're so oriented in our work to bringing the patient into our zone of relatedness and understanding, where we are comfortable and we can do the work of understanding and relating. I'm interested to allow myself and the patient to find our way into worlds of non-understanding, of non-relatedness, of silent scream, of unrepresented pain and confusion. Enactments are thus the medium within which the healing takes place, where time, space, self, and other begin to take shape. Am I going too fast? Or am I sort of okay? Sort of, all right. Okay, I'm trying to get a lot in. I'd like to tell you about a case. I wanted to not spend too long with the theory, but to get to a case that hopefully captures some of these ideas, which hopefully will bring you into the process.
Robert,
so this, yes.
Robert, people ask if you can speak a little bit slower. And אני גם רוצה להגיד למי שנמצא בזום, שנשלחו אליכם ההרצאות, כך שאתם יכולים לעקוב אחרי, תמצאו את זה במייל שלכם. Okay, sorry.
No, I'm sorry if I'm going. I think I feel a little pressure to get it all in. But all right, I hopefully you got the idea that if there is this area of pre-experience that exists in what Scarfone calls an unpast, it is untouched by time, which I think is such a beautiful image. And some of the work, and you'll see, involves the instantiation of time. So I took that idea of the unpast and I conceive of enactment as the untelling of that unpast. It's a completely unconscious representation of something that has yet to have form in the mind of the patient and is frozen in time, if that makes sense. If that was clear, we're all on board, okay? Okay, so this is the story of Alan. As I said, I have mentioned this case before, but it's more has happened and I have other ideas. Alan first called me on the phone. He explained that although things were going well in his life, he was really struggling and he needed to talk to someone. I found a short, stout man of my age, dressed in typical business casual attire, sitting in my waiting room. He was weeping. Once in my office, he said that his life was generally good. He said, but I have crises in my mind. An only child, he described a tortuous relationship with his mother. She had dominated and intruded in every aspect of his life, his mind, and his body. She had idealized him, made him feel that he was totally special, and that the little world of his mother, his father, and he was a perfect Eden, Garden of Eden. However, his mother demanded total compliance and submission, and would viciously attack him if he expressed any inclination to have his own thoughts and his own feelings. His mother's intolerance of his independent thought was profound, as were her intrusions into his body and his sexuality. She encouraged him to tickle and play with his penis when a young child, and she forbid any closed doors in the house. Thus, as later, as an adolescent, he would masturbate with the door open. As a young child, on one occasion while he was sitting on the toilet, his mother came to the doorway and said, "Have you ever wondered what a woman's body looks like?" She took off her clothes and stood there naked. Here, a woman. She was manically concerned about his health. The slightest symptoms would prompt hot and cold compresses, and she would feel his body all over for lumps and swellings. Oh my God, it must be cancer. She idealized his body, adoring his strong legs, and gleefully drew other children's and parents' attention to his amazing physique at soccer games, school soccer games. He was mortified, ashamed. When he expressed his own ideas, she would be disdainful and downright aggressive. He lived in terror that she could throw him away, as he had witnessed her do with countless friends and relatives. She would drill into him with messianic zeal, "No one will ever love you like I do, no one." Alan's father was little more than a target of her derision and scorn. Largely dissociated and seemingly happy with a good bowl of pasta, he offered very little in the way of psychological presence, let alone any protection. With so little to hold on to that could feel like his own, Alan became obsessed with masturbation and sex. He masturbated in class under his desk in elementary school, and he later soothed his anxiety in exams by masturbating during the test itself. There were occasions when he became in trouble because of this. By the time I met him, married with 3 grown children. He had followed a secret life of prostitutes and pornography through much of his marriage and was in the grip of a lifelong foot fetish. He was obsessed with women's feet, older, ugly, misshapen feet, which he was quite clear were very much like his mother's. He found pornography that showed women's feet terrifically arousing, and particularly fetish porn that involved the use of women's feet. In the warm weather, he was beset by overwhelming stimulation of the open-toed shoes and sandals that women wear. Since a young child, he was also drawn to images of women acting violently against men, particularly kicking or punching men in the testicles. He wanted desperately to come to some understanding of this fetish. He was initially helped by my idea that he was drawn to the part of the woman's anatomy furthest from the genitals, but still a part of her body. It made sense to him that it was a way to keep himself, his sexuality, and his tie to his mother alive while managing his mother's intrusive overstimulation. A kind, if you like, a kind of creative transitional object, the fetish as transitional object. For the first 2 years of this 3 times a week treatment, Alan was in very much pain. He would cry in sessions and secretly weep in the bathroom at work. He spoke of dearly loving his wife and children. He wanted to be close to his wife, Sarah, and very much wanted to have sex with her. But any attempts to do so prompted a full-blown panic attack. And he knew this. He said, look, it's my mother. I can't get close to Sarah. If I do, I am abandoning my mother. An interesting part of this work is he understood the problem. So that was clear to him. He had not developed the capacity to be alone, or a sense of constancy. I think we're getting a little feedback. Oh, okay. He had not developed a sense of object constancy. He would be beyond distraught if he could not reach his wife, Sarah, on the phone. And on one occasion, I found him weeping and disoriented. Our session was in the morning at 7:30, early New York time, New York life, crazy. And I get in at 7:15 to get ready and so on. I got there 7:20. He had arrived early, not realizing the time, and was weeping and having a breakdown because I wasn't there and completely lost track. Took him a long time to recover. He has engaged deeply in the treatment. I think he was initially very interested in my suggestion that I was interested in all of his complicated feelings about his mother, including his love and his longing for her. And also the idea that the pain that he was suffering had meaning in terms of his inner life. To us, this is an obvious idea, right? The pain you feel is related to what's going on inside of you. For him, he's come back to that many times as an amazing piece of insight. It had never occurred to him. I've been unobtrusive to his ownership of the treatment, allowing his associations and thoughts primacy over mine. Thus, he has actually begun to locate his experience within his own person. They're not just things that happen to him. And in doing so, he has foregrounded the degree to which he now realizes he's been inhabited by his mother and his father. He would say, who is talking right now? I can't tell. Is this my mother talking? Is this my father? Whose voice is this? He says, my mother totally dominated me. I have her body. I have her mind. He also noticed how easy it is for him to feel satisfied after a burger and a beer. He goes, oh no, now I'm like my father, fat and happy. So an empathic understanding of his parents as traumatized people has helped him begin to grieve and relinquish their hold on him. And they are long gone, and he prays for their souls in church. He's a churchgoer, and he prays that they should be healed. Gradually, he came to hold me in mind as a transitional object, and that has helped him. When he wakes up in the night in a state of panic, he would say to himself, it's okay, I have Gros-Mark tomorrow. And he's begun to, at this point, he had begun to sexually engage with his wife, not ready for intercourse, but overall, things were feeling much better. Despite these improvements, I was aware that the realignment of these more embedded objects and the resolution of the unconscious registers of fetish, confusion, and sexuality could only take place in the lived and somatic dimension of mutual enactment. Which brings me to one day, a holiday, a public holiday, when he had not gone to work and he was planning to go to the gym after the session. So he came into the session wearing a sleeveless t-shirt, which, one that is cut off at the sleeves, He leans back on the couch and he spreads his arms like this, bearing his naked armpits. And I feel like, oh my goodness, is it possible? He seems to have no armpit hair. Can this man, Mr. Business Casual, Mr. Comfortable, kind of ugly shoes, not very fashionable, Mr. Basic haircuts and practical eyeglasses, is it possible that he shaves his armpits, that he manscapes? I cannot believe it. No. He would seem to be the last person on the planet who I would ever have thought would do that, would shave his own body hair. And I am compelled to peek. I am pulled into a fetish state of mind where I simply cannot pull my eyes away from his armpits. And tell me this, this must have happened to at least some of you where you're in sessions and it's like, just don't look, just don't, whatever that is, you've been there, right? So I am compelled to his armpits. I mean, it's pulled into a fetish state of mind where I simply cannot pull my eyes away from his armpits, cannot free my mind from the question, does he or doesn't he? Does he or doesn't he shave his armpits? I'm helplessly in the grip of a fetish state of consciousness for almost the whole of the session. I would later pull together the thought that this was an enacted version of his infantile and childhood experience, and untelling. My does he or doesn't he is the enacted version of his unconscious. Does she or doesn't she, mother, have a penis? This question and the resulting confusion, does mother have a phallus or not, is at the center of classical Freudian and Lacanian formulations of foot fetishism. The foot is regarded as the manifestation of the mother's phallus, and he has been psychically, he has been his mother's phallus. So meanwhile, while I'm having this kind of tortuous, kind of crazy experience, what is going on? He is telling me, that things are going well at work. He's been promoted. And then he tells me a dream in which a small man is located in a much larger and aggressive robot, and in which there were different realities. The robot recalls for him, he's associating, his favorite episode of Star Trek, The Next Generation, the sci-fi series. Most people have some familiarity. In that episode of Star Trek, in order to survive, a planet has sent a probe into Captain Picard, the captain played by the British guy, Patrick Stewart, no less. The probe that was relayed into the captain relayed the whole story of the planet so that history would be preserved and known. The planet would survive because it would exist in his mind. Only by being remembered in the captain's mind could the planet survive. Captain Picard reminds him of his leadership role at work, and he ends the session talking about how pleased he is with his more mature behavior at work. Thus, he has shown me how he has survived by encapsulating this little person inside a larger robotic persona, while I was immersed in the fragmented experience and breakdown of the little boy. He is growing up and becoming a captain at work, while his survival and growth, like the planet of the episode, depends on his sending a probe into me, so I will remember and know his yet to be experienced self. Hence my enacted experience of living through not knowing whether he does or does not shave his armpit. This was the untelling. I am living a story that did not yet exist for him. And I had a momentary altered state of breakdown and immersion in an altered state of consciousness. So the treatment becomes the place where this aspect of yet to be experienced unpassed could become an actual reality. For me, an enacted untelling where he inhabited the body of his mother, if you like, and I, the mind of the overwhelmed, overstimulated, traumatized body. Some months later, he did tell me, by the way, I do shave my pubic hair, you know, and I shave all over my body, and told me that he has a little razor and he feels clean, and you can't help but think like a baby, right? And shaves, he feels smooth and clean. So after this sequence, he continued to feel better, things were going well, and I do feel that my holding my altered state and metabolizing it and not asking him to do an intellectual kind of work on it gave him the space to continue moving. But there's an important piece. Before the dream, I had realized how much hatred I was holding for him. During a session which included some more harrowing stories about his mother's penetrations, he told me a lot at length about his great admiration for who was then President Trump. He says, that's a real man I can admire, a real straight shooter. And I just thought, I hate this shit. It was unbearable. But then I thought, oh, now I see. His mother must have hated him in certain states. Ambivalence wasn't part of the mother's repertoire. She couldn't love hatefully and hate lovingly, in Ogden's words. So I did feel some hatred and some shock at his admiration for Trump. But here was an opportunity to own and even enjoy my own hatred without losing my care, my love for him, my connection to him, so that I would become a mixed, robust object, loving, hating, phallic, receptive, and also a different register of masculinity, and not simply. So I think that anger and hate were being transformed. Things were not simply black and white, and ambivalence could be tolerated, even embraced. So in a session shortly after this, Alan paused after talking about various kinds of pornography that he had used to prepare for intimacy with his wife. He would prepare by looking at porn to get himself kind of charged. And he talked for the first time about wanting to have a mutual experience with his wife without any images of porn. He notices, like, why am I doing this? With Sarah, he says, I can come, I can orgasm, but I actually want her to be a real part of it. I don't want it to simply be another kind of masturbation. I love her. Thus, Alan and I lived an untelling, both of fetish as a way to manage overwhelm and profound confusion in the face of maternal invasion and of disavowed hatred in the mother's unconscious. We lived through yet to be symbolized and represented trauma, breakdown, and too muchness, and we survived. And thus he was able to begin to really want to connect to his wife as a whole person and have his desire be related to her. And I understood that my experience of fetishistic compulsion and my experience of hatred were presences of his early breakdown that he'd never been able to experience as a child. I contained them and I held them safely, such that they could begin to be thought and understood within my mind and my body. And I think it's this ability to contain and hold the breakdown that the patient is yet to be able to tolerate that safely kind of welcomes the trauma and breakdown into the treatment. In time, Alan came to know and transform his own breakdown and in the treatment. How are we doing in terms of time? I don't want to, can someone tell me where I am in terms of time? Because there's a couple more quick episodes.
We have 10 more minutes, so it's okay.
Okay, I think I'll make it. I think I'll, during COVID-19, Alan and his wife relocated to a remote area upstate New York. A lot of people relocated, we know. And we continued online. And he really began to struggle with the absence of his familiar surroundings, his routine, and the whole experience of coming to my office. We were working via Zoom. His anxiety began to really escalate, and there was an ongoing sense of panic, and further into a terrifying experience of falling apart. He was weeping and screaming in sessions and was holding himself in a fetal position. I became worried about his well-being, and I began to consider alternative and higher levels of treatment. I really worried, maybe this guy, maybe it's time, he may need to be in somewhere. However, I was calmed by the fact that he continued to work at a high level. He was doing his work well, and he would organize himself after sessions. We developed a ritual of closing down the session slowly, where he could begin to pull himself back together. That was his suggestion, and it worked beautifully. But I felt that I was finally meeting the inner dissociated world of breakdown that he had never been able to experience within him. Thus, in one session, he cried out, "Help me, I can't go on. I am losing my mind." And I told him that I didn't feel he was losing his mind. I told him, "I believe you are finding your mind, finally, and you're finally in touch with the inner pain and the terror that you've never been able to experience." And further, I said that we're going to be able to hold that pain, and we're going to know it fully for what it is. He found this extremely helpful. Over subsequent sessions, his cries transformed from terror and panic to sadness and deep, deep grief for the little boy who had had nothing and no one to hold on to and was overwhelmed and terrified every day. And he gave me lots of examples. On many occasions, he would ask me, "Are you there? Are you with me?" And I would always reassure him, "Indeed, I'm here." And I very much felt that I was understanding him in a deeper way. Of course, the most vivid opportunity to live through the experience of abandonment and neglect, and thus to transform the unpassed into an untelling, came via the register of mutual enactment, when I became the unfeeling and invasive mother. After another session in which Alan talked of his deep loneliness, I had asked whether he might find some solace in telling his wife some of what he was struggling with. Consciously, I felt that, as often had happened in the past, he might find comfort in contact with his wife. Retrospectively, it is clear to me that I was wilting. I was kind of breaking under the relentless pressure of these intense Zoom sessions where he was so vividly and heartbreakingly breaking down. In attempting to take care of myself and my needs rather than staying aligned with him, I'd momentarily embodied his mother, and he picked it up, if that makes sense, right? It was my need to get to move him along, really. And he picked it up immediately. In the next session, he told me that he had dreamed that he was on a day trip to the beach with his mother. He didn't have the right clothes. His mother yells at him that he should have brought the right clothes. And he felt, you, Mom, should have helped me. I don't have anyone there for me. And Dr. Gurusmark says I should talk to my wife. But I'm not ready. My mother's pushing me away is hardwired into me. There were further dreams. I won't go into them. In one, very quickly, the wife was taking some frozen food out of the freezer and trying to unfreeze it. She tries to unfreeze it by taking a pickaxe to it, right? Rather than letting it right? And he says, why don't you let it just thaw naturally? can I get the point here? You know, right? And there was another one where the coach in school expects them to do much higher level athletics, etc. So he's telling me that I'm misaligned with him, and I've moved things along too fast. I have wanted him to be someone I needed him to be, to deal with my panic and my anxiety, you know, and rather than take care, and I had abandoned the little boy. So he tells me, yes, when I talk to my wife, I'm talking about the little boy. He can't be really present, but when I'm here with you, the little boy is here with you. And that's different. And I told him that I really got it, and I got what he was saying. And I wanted to own these things, to validate his reality, make it real. It is happening. And I told him, I know. I rushed us along, and we had quite a back and forth. He was grateful, particularly that I could validate that. So since that sequence, he's feeling increasingly better, more kind to himself. He would be so punishing to himself. And a new dimension has opened up in the treatment. There's a revisiting of his mother's life in a more meaningful, more three-dimensional way. And these conversations have just an alchemy of pain, anger, empathy. The little boy's day-to-day terror and collapse now make so much sense. And he said recently of his mother, she was just living in her own hell. She held on to me for her own sanity. It's unbearably sad, which was, you know, it's the melancholy where a patient, it's right, you hear that, right? And so look, the treatment became the place where Alan could be the little boy, and he could have the breakdown, then this time be companioned in the breakdown, that it didn't happen on his own inside his yet to be developed body and mind. And the unpassed became an actual lived experience. So time is back, because when you have time, you can reminisce and look back and see the mother as someone who existed in a past rather than someone who's living inside your body right now. So there's a lot more to say about the dimension of where time has come back, and there's a present and a past and a future, which is something that Lou Aaron and Gali Dablis had a lot to say about in terms of the perspective function and the enactment as future, but that's for another time. He said recently, it's the past, it's there. It's not like I've lived it yet, and I'm finally living it now. Thanks for listening, guys.
Thank you very much. Thank you very much, Robert. And some people are applauding your beautiful description, I think both theoretically and clinically, so moving and detailed in a way that I think a lot of us could resonate with. You talked about maybe some of us had similar experiences where you don't want to look, you don't want the patient to tell, maybe you just don't want to be there. But also, I think I found very moving your description of what happened to your patient during the COVID-19. And I think certainly most of us can resonate with that, where people really regressed and became almost unreachable via verbal, regular interpretive work. And I think your way of dealing with this situation is extremely moving and telling about the unobtrusiveness of the therapist intervention as the path to healing. So thank you very much.